For patients requiring extracorporeal circulatory support, a growing body of evidence suggests that earlier deployment of support is a critical determinant of success. Early support promotes cardiac recovery. Cardiac Assist has developed a percutaneous extracorporeal circulatory support system, the TandemHeart system. The TandemHeart system can provide up to 5.0 liters per minute of cardiac output for a multitude of patient presentations. Preload reduction and systemic perfusion are achieved through left atrial to femoral artery bypass, with access from the femoral venous and arterial system. Oxygenated blood is drawn from the left atrium via a drainage cannula and returned to the systemic circulation via 1 or 2 arterial cannulae. The TandemHeart can be rapidly inserted in the cath lab or operating room in as little as 30 minutes. Description of components. We will now describe the system components and their function. Refer to the procedure guide for more detailed setup and operating instructions. The TandemHeart system includes the pump, controller, transseptal and arterial cannulae sets, and accessories. The TandemHeart procedure kit is packaged sterile and includes the centrifugal pump with pre-attached tubing, transseptal cannula, an Infusate tubing set, and syringe. A 12-foot Infusate line and electrical cord connect the pump to the controller. The transseptal cannula is packaged sterile and consists of a 21 French transseptal cannula with 3/8-inch barbed end connector and suture wing, a 13 French obturator with hemostasis cap that accepts a maximum 0.035-inch diameter guide wire is used to facilitate placement of the cannula, and a 14 to 21 French two-stage dilator for facilitating access to the left atrium. Arterial cannulae with 3/8-inch barbed end fitting that offer optimal kink resistance and flow characteristics are recommended. Flow rates of approximately 5.0 liters per minute have been achieved with a 17 French cannula and approximately 4.0 liters per minute with a 15 French cannula. A holster set is used to secure the pump to the patient's leg after support is initiated. This single-use non-sterile set includes a neoprene thigh wrap, C-shaped pump holster, and connector tube tie-downs. The Infusate tubing set comes pre-connected with a bacteriologic filter, stopcock, and pressure transducer that monitors the Infusate pressure in the TandemHeart pump. Hospital-supplied items include tubing clamps, scissors, and transseptal access supplies. The TandemHeart Escort controller powers the system, provides diagnostic alarms during operation, and flow measurement. It operates on AC current and also has internal batteries to provide 60 minutes of continuous operation during patient transport. The controller should be plugged into AC power at all times to ensure the batteries are fully charged. The controller incorporates redundant control units to ensure reliable operation. The display serves as the user interface to monitor and control system operation. The control panel has 4 major components. The Start-Stop button activates pump operation. The Alarm Mute button temporarily silences the audible portion of an alarm. The Speed Control knob adjusts pump speed and revolutions per minute to increase or decrease cardiac output in liters per minute. The Menu button allows for screen selection and user interface. Assembly and priming of the Infusate line. We will now describe the TandemHeart system setup and Infusate priming procedures. First, power up the controller. The powering procedures takes up to 3 minutes. The controller is ready for operation once the View and Skip menu screen appears. The on-screen instructions will show you the procedure for setting up the Escort controller. Remove the IV set from the sterile package. Plug in the pressure transducer cable and wait for the status that the calibration is OK. Cover with the plastic boot and close the roller clamp. Hang a bag of saline for injection from the Infusate bag holder located at the top of the controller handle. Inject the bag with heparin to obtain a concentration of 900 international units per milliliter. Label the bag with the heparin concentration and date, and spike the heparinized IV bag. Squeeze the drip chamber until it is 2/3 full of heparinized saline. Priming the TandemHeart pump requires two people, a person scrubbed in the sterile field and a controller operator in the non-sterile field. The controller operator connects a 20 cc syringe to the stopcock, opens roller clamp, and fills the syringe from the IV bag. The controller operator will present the sterile TandemHeart pump to the sterile field. The scrubbed person then hands the ends of the pump's external communicating line and Infusate line to the controller operator. The controller operator then connects the pump's infusion line to the bacteriologic filter at the end of the infusion assembly and connects the pump power line to the pump power receptacle on the front of the controller. The controller operator slowly injects 15 cc's of heparinized saline into the pump infusion line to prime the lower housing of the pump. This will gradually fill the pump's lower housing. Note: maintain continuous pressure on the syringe throughout the pump priming process to make sure that air is evacuated. Close the stopcock to the syringe prior to removing pressure on the syringe or prior to removing the syringe. The controller operator refills the syringe with heparinized saline from the infusion bag. Hold the pump with the inlet port, blue stripe, horizontal. Turn the stopcock off to the bag while starting to inject the heparinized saline. Then press the pump start-stop button. The pump will automatically run at a speed of 7,000 RPMs for 10 seconds. Turn the stopcock off to the pump, holding pressure on the syringe until the stopcock is closed. Inspect the lower housing of the pump for air bubbles. If air bubbles are present, restart the pump and inject another 15 cc's of heparinized saline. The infusion tubing set must now be laced into the infusion pump on the controller infusion panel. Escort infusion lacing. Make a loop in the infusion assembly tubing so that the IV inflow is on the left and the IV outflow is on the right, or use the pre-formed loop in the infusion tubing with the word front located on the tubing guide facing toward you. Open the two doors on the infusion pump and place the loop around the cam in the infusion pump. Pull down on the tubing loop. Close left side infusion door first, then right side. Insert a portion of the pump infusion line between the bacteriologic filter and the protective sheath on the pump communication line into the air bubble detector by simultaneously pushing and pulling the pump infusion line. Check for drips in the infusion assembly drip chamber. Controller must be powered on and roller clamp and stopcock must be open. Verify that 10 plus or minus 3 drops per minute are observed in the Infusate drip chamber. Place the pressure transducer in the mounting bracket. The optional integrated flow sensor can be plugged into the controller and placed on the pump outflow tubing. Insertion of the transseptal and arterial cannulae. The next step is to insert the transseptal and arterial cannulae. For the transseptal cannula, insert the obturator into the transseptal cannula until the hub is secured inside the hemostasis valve. Make sure that the tip of the obturator is extended fully from the cannula. Use a standard transseptal puncture technique to gain access to the left atrium from the femoral vein. Introduce the guide wire through the needle and into the left atrium. Then remove the transseptal needle and Mullen sheath. Administer heparin to raise the ACT level over 400 seconds. Advance the two-stage dilator over the guide wire until the largest diameter section enters the left atrium. Then remove the dilator. Insert the obturator cannula assembly over the guide wire into the left atrium. Confirm position of the tip of the transseptal cannula inside the left atrium using fluoroscopy, pressure transducing, blood gas analysis, or echocardiography. First, remove the guide wire and obturator until it is beyond the clamp area of the cannula. Then, leaving the hemostasis valve in place temporarily to control blood loss, clamp the cannula in the clamp area and remove the obturator, wire, and hemostasis valve from the cannula. Make sure the cannula clamp is securely in place. Note the transseptal cannula depth marking and secure the cannula to the patient via the suture wing. Using the modified Sullinger technique, place the arterial cannula in the patient's femoral artery. Remove the wire and obturator, clamping the cannula. Secure the arterial cannula to the patient's leg via sutures. Final circuit assembly. With the controller setup complete, and with both cannulae in position and secured, and the pump de-aired, the pump can now be connected to the rest of the system. Note, over the years, surgeons and perfusionists have developed many techniques for the de-airing of extracorporeal blood circuits. The following is one of many techniques that could be used. Hold the TandemHeart pump by the inflow, blue, and outflow, red pump tubing. Slowly fill the pump inflow tubing, blue, using a syringe or a septo with saline from the sterile field. Note, while slowly filling the pump inflow tubing, blue, the pump and pump outflow tubing, red, will also start filling up. Clamp each tubing with a separate pump tubing clamp just below the saline level. Check for air bubbles in the tubings and in the pump. If any air bubbles are present, hit the pump with the palm of the hand to dislodge the air bubble and work the bubble up to either the pump inflow or outflow tubing. Once the air bubble is below one of the pump clamps, release that pump clamp and re-clamp the tubing just below the saline level. Locate the pump in close proximity to cannulae and patient's thigh. Connect the pump outflow, red tubing to the arterial cannula using a wet-to-wet connection. Fill the outflow tubing from the pump with saline and fill the arterial cannula as well. Then connect the two via a wet-to-wet connection. Repeat these steps for the inflow tubing. Inspect pump and tubings for air. It may be necessary to disconnect the pump inflow tubing from the arterial cannula to remove any entrapped air. Connect the pump inflow tubing, blue, to the transseptal cannula using a wet-to-wet connection. Inspect pump and tubings for air. It may be necessary to disconnect the pump inflow tubing from the transseptal cannula to remove any entrapped air. Once all air is removed, push tubings over second barbs on both cannula. Release the clamps on the pump inflow tubing, blue, transseptal cannula and pump outflow tubing, red. Note, leave the clamp on the arterial cannula. Start the pump, which will start at 5,000 RPMs. Check for air bubbles. If tubing and pump are air-free, slowly release the clamp on the arterial cannula. Increase the pump speed until the desired level of support is achieved. Initiation of support. Now that the system is in operation, the pump should be secured to the patient's thigh. When appropriate, remove the sterile drapes from the cannulae insertion sites and place the neoprene thigh wrap around the patient's leg above the knee. Snap the pump into the holster and position the assembly on the thigh. If available, a knee immobilizer can be used to minimize patient movement and avoid cannula dislocation or dislodgement. Secure the tubing to the thigh wrap with the Velcro connector tube tie-downs. The TandemHeart Escort controller has internal batteries to provide continuous operation during patient transport to a critical care unit. The system will operate for at least 60 minutes on fully charged batteries. The elapsed time can be viewed on the controller touchscreen. Cardiac Assist is collaborating with cardiologists and cardiac surgeons from around the world to develop solutions to curb cardiovascular disease. We have assembled a team that is meeting the challenges head-on by providing a unique extracorporeal circulatory support system. TandemHeart is a registered trademark of Cardiac Assist Incorporated.